Hello everyone, I'm Dr.MemetIşık. Today we're diving into an important topic, a comprehensive guide to liver cancers. We'll discuss its types, symptoms, and stages and explore the treatment options available to patients. Liver cancer is a severe disease. It affects millions of people worldwide. It is a leading cause of cancer deaths. Understanding liver cancer is crucial. This includes knowing the symptoms, causes, and treatments. This knowledge empowers individuals. It also helps with early detection. Early detection improves treatment outcomes. Primary liver cancer starts in the liver. When cancer spreads to the liver from another organ, it is not primary liver cancer. In this video, we will focus on primary liver cancer. It aims to provide a clear and concise understanding of this complex disease. The liver is essential for life. It is located on the right side of the abdomen, below the ribs. The liver has many functions. It produces bile, which helps digest fats. It stores sugar for energy. It also filters toxins from the blood. When the liver is damaged, these functions are affected. This can lead to serious health problems. Liver cancer can severely impair the liver's ability to function properly. There are different types of primary liver cancer. The most common type is called hepatocellular carcinoma, or HCC. HCC accounts for most adult cases. It is a major cause of cancer deaths globally. Another type is bile duct cancer, also known as cholangiocarcinoma. Bile ducts carry bile from the liver to the gallbladder and small intestine. Cancer can develop in these ducts. Each type of liver cancer requires a specific treatment approach. Liver cancer often doesn't cause symptoms in its early stages. This is why early detection is difficult. As the cancer grows, symptoms may appear. These symptoms can vary. Common symptoms include a lump or pain on the right side of the abdomen below the ribs, yellowing of the skin and eyes, also known as jaundice, loss of appetite and weight loss, fatigue and weakness, nausea and vomiting. If you experience any of these symptoms, consult your doctor immediately. Early diagnosis is crucial for successful treatment. The exact causes of liver cancer are not always clear. This type of cancer can develop due to a variety of factors, some of which are still being studied by researchers around the world. While the precise mechanisms remain elusive, understanding the risk factors can help in identifying those who are more susceptible to the disease. However, several risk factors increase the likelihood of developing the disease. These risk factors can be broadly categorized into lifestyle choices, environmental exposures, and genetic predispositions. By examining these categories, we can gain a clearer picture of what might contribute to the onset of liver cancer. These include chronic hepatitis B and C infections, which are among the most significant risk factors. These viral infections can be contracted through various means, including unprotected sex, sharing needles, or from mother to child during childbirth. Chronic hepatitis B and C can lead to chronic liver inflammation and damage, which over time can cause significant scarring and deterioration of liver function. This persistent inflammation creates an environment conducive to the development of cancerous cells, increasing the risk of hepatocellular carcinoma, or HCC. HCC is the most common type of primary liver cancer, and its association with chronic hepatitis infections underscores the importance of early detection and treatment of these viral conditions. Cirrhosis, which is scarring of the liver often caused by chronic hepatitis or alcohol abuse, is another major risk factor for liver cancer. Cirrhosis can also result from other conditions such as non-alcoholic fatty liver disease, NAFLD, and autoimmune hepatitis, is a major risk factor for liver cancer. The scarring disrupts the normal structure and function of the liver, making it more susceptible to malignant transformations. This is why managing and treating the underlying causes of cirrhosis is crucial in reducing liver cancer risk. Heavy alcohol use can damage the liver, leading to cirrhosis and increasing the risk of HCC. Alcohol-related liver disease is a significant public health issue, and reducing alcohol consumption can markedly decrease the risk of developing liver cancer, leading to cirrhosis and increasing the risk of HCC. Aflatoxin exposure, a toxin produced by certain fungi that can contaminate food, is another risk factor. This toxin is commonly found in improperly stored grains and nuts, particularly in regions with hot and humid climates. A toxin produced by certain fungi that can contaminate food also increases the risk of liver cancer with long-term exposure. Aflatoxin exposure is a significant concern in agricultural communities, and efforts to improve food storage and handling practices are essential in mitigating this risk. also increases the risk of liver cancer with long-term exposure. Additionally, genetic factors can play a role in liver cancer risk. Individuals with a family history of liver cancer or certain genetic disorders may be more prone to developing the disease. Understanding these risk factors is crucial for prevention and early detection. By being aware of the potential causes and taking proactive measures, individuals can significantly reduce their risk of liver cancer. Regular screenings, vaccinations for hepatitis B, and lifestyle modifications are key strategies in combating this disease. Preventing liver cancer involves reducing exposure to risk factors. Vaccination is available for hepatitis B and is highly effective in preventing the virus. However, there is no vaccine for hepatitis C yet. Other preventive measures include limiting alcohol consumption, as moderate alcohol intake or abstinence can significantly reduce liver damage risk. Ensuring food safety by properly storing and handling food can prevent aflatoxin contamination. Managing other health conditions, such as controlling diabetes and obesity, can reduce the risk of non-alcoholic fatty liver disease, which is a potential risk factor for liver cancer. Screening and early detection of liver cancer. Early detection of liver cancer is crucial for successful treatment. Unfortunately, there is no single, standard screening test. However, certain tests are used to monitor high-risk individuals. Ultrasound. This imaging test uses sound waves to create pictures of the liver. It can detect abnormalities. Blood tests. Alpha-fetoprotein or AFP is a protein produced by some liver cancers. Elevated AFP levels may indicate the presence of cancer. It's important to note that these tests are not foolproof. They may miss early-stage cancers. Individuals at high risk should discuss screening options with their doctor. Diagnosing liver cancer usually involves a combination of tests. These include physical exam. The doctor will examine the abdomen for any lumps or tenderness. Imaging tests. CT scans and MRI scans provide detailed images of the liver, helping to identify tumors. Biopsy. A sample of liver tissue is removed and examined under a microscope to confirm the diagnosis. Early diagnosis is essential for better treatment outcomes. Treatment options of liver cancer. Treatment for liver cancer depends on several factors. These factors are crucial in determining the most effective approach for each individual patient. These include the stage of the cancer, the patient's overall health, and the liver's function. The stage of the cancer is determined by how much it has spread within the liver or to other parts of the body. The patient's overall health is assessed to ensure they can handle the treatment. The liver's function is evaluated to understand how well it is working and to decide the best course of action. Treatment options include surgery. Surgical removal of the tumor is an option for early-stage cancers. This involves removing the part of the liver that contains the cancer. Surgery is often considered when the cancer is confined to a small area and the liver is functioning well. The goal is to completely remove the cancerous tissue while preserving as much healthy liver tissue as possible. Liver transplant. In some cases, a liver transplant may be an option. This involves replacing the diseased liver with a healthy one from a donor. A liver transplant is usually considered when the cancer is in its early stages and confined to the liver, but the liver is too damaged to function properly. This procedure can offer a chance for a cure, but it requires finding a suitable donor and the patient must be healthy enough to undergo the surgery. Ablation therapy. This procedure uses heat or cold to destroy cancer cells. Techniques such as radiofrequency ablation, microwave ablation, or cryoablation are used to target and kill the cancer cells. Ablation therapy is often used for patients who cannot undergo surgery. It is a minimally invasive procedure that can be performed using imaging guidance to precisely target the cancerous tissue. Chemotherapy. Chemotherapy drugs are used to kill cancer cells. These drugs can be administered orally or through an intravenous line. Chemotherapy is often used when the cancer has spread beyond the liver or when other treatments are not suitable. It works by targeting rapidly dividing cells, but it can also affect healthy cells, leading to side effects. The goal is to shrink the tumors, slow their growth, and alleviate symptoms. Radiation therapy. High-energy rays are used to target and destroy cancer cells. This treatment is usually considered when the cancer cannot be removed by surgery. Radiation therapy can be delivered externally or internally. External beam radiation therapy directs high-energy rays at the cancer from outside the body, while internal radiation therapy involves placing radioactive material directly into or near the tumor. The aim is to damage the DNA of the cancer cells, preventing them from growing and dividing. The choice of treatment is individualized. Each patient's case is unique, and the treatment plan is tailored to their specific needs. Factors such as the size and location of the tumor, the patient's age, overall health, and personal preferences are all taken into consideration. It is based on the specific characteristics of the cancer and the patient's condition. The healthcare team works closely with the patient to develop a comprehensive treatment plan that aims to achieve the best possible outcome. This collaborative approach ensures that all aspects of the patient's health and well-being are addressed, providing a holistic and personalized treatment strategy. Researchers are constantly working to develop new and more effective treatments for liver cancer. This relentless pursuit of knowledge and innovation is driven by the urgent need to improve patient outcomes and quality of life. Every day, scientists and medical professionals collaborate, sharing insights and discoveries that could lead to groundbreaking therapies. These efforts are not confined to laboratories. They extend to clinical settings and even outdoor environments where researchers can engage with the community and gather real-world data. Clinical trials are an essential part of this process. They serve as the bridge between laboratory research and real-world medical practice. Through these trials, new treatments are rigorously tested to ensure they are safe and effective for patients. This process involves multiple phases, each designed to answer specific questions about the new therapy. From initial safety assessments to large-scale efficacy studies, clinical trials provide the critical data needed to bring new treatments to market. They evaluate the safety and effectiveness of new therapies. This evaluation is crucial because it helps identify potential side effects and determine the optimal dosage. By participating in clinical trials, patients contribute to this vital research, helping to refine and improve treatments. The data collected from these trials not only benefits current participants but also future patients who may receive these therapies. If you or a loved one has liver cancer, consider participating in a clinical trial. Participation can offer access to cutting-edge treatments that are not yet widely available. It also provides an opportunity to be closely monitored by a team of healthcare professionals who are experts in the field. This level of care can be reassuring and provide additional support during a challenging time. It could provide access to cutting-edge treatments. These treatments may offer new hope for patients who have not responded to standard therapies. Additionally, being part of a clinical trial means contributing to the advancement of medical science. Your participation can help researchers understand more about liver cancer and how to treat it effectively. It also contributes to advancing cancer research. Every piece of data collected, every observation made, adds to the collective knowledge about liver cancer. This information is invaluable for developing new treatments and improving existing ones. By participating in a clinical trial, you are playing a crucial role in the fight against cancer. In conclusion, liver cancer is a complex disease. It requires a multifaceted approach to treatment and care. Clinical trials are a key component of this approach, offering hope and potential new options for patients. The collaboration between researchers, healthcare professionals, and patients is essential for making progress in this field. However, with increased awareness, early detection, and advancements in treatment, there is hope for improved outcomes. Public awareness campaigns and community health events play a significant role in educating people about the importance of early detection and the options available for treatment. These efforts can lead to earlier diagnoses and better prognosis for patients. If you have any concerns, consult your healthcare provider. They can provide personalized advice and guide you through the options available, including the possibility of participating in a clinical trial. Open communication with your healthcare team is crucial for making informed decisions about your health. Early detection and treatment are crucial for a positive prognosis. Regular health checks and screenings can help catch liver cancer in its early stages when it is most treatable. By staying informed and proactive about your health, you can take important steps towards ensuring the best possible outcomes. If this video has inspired you, please like it and share it with others. Don't forget to subscribe to our channel, Holistic Cancer Care, to stay informed and discover more valuable insights on cancer prevention and holistic healing.